The Polypharmacy project in Brighton is aiming to deliver joined up medication reviews for our vulnerable elderly population with problematic polypharmacy, to support GPs and to integrate the pharmacy services that exist currently across the city, with a specific aim to reduce hospital admissions and to reduce harms from medicines, and to offer support to GPs for this.
We really hope to be working closely with GPs because these are patients that often it's difficult to really provide that complex medication review in the 10-minute appointments. Often they're patients that ideally you would visit at home to do this, and so we hope that we will be supporting this kind of at-risk population for GPs, identifying any changes in medication that might be appropriate to optimise things. In 3 of the clusters in Brighton and Hove, in cluster 1, 3 and 6, there are already some specialist pharmacists working in the community. And our pharmacists will be working alongside them, but seeing a different cohort of patients. So the better care pharmacists are identifying patients from general practice, from risk stratification. And the cohorts we're going to be looking at in particular are patients that are identified in hospital as at risk of medication harm when they're discharged, and also patients that are new to care homes. So they'll be working really closely with the better care pharmacists and doing very similar high quality level 3 reviews in the patients' homes. They'll also be communicating with GPs in a very similar way, so that will be using their clinical systems to send messages within the clinical systems as tasks, and this will mean that for GPs it will be a very similar process.
So I think this project is going to really bring to the forefront the need for a multidisciplinary approach to patients at risk of a medication-related harm. Having a pharmacist in combination with and working very closely with the GPs, it will really optimise best outcomes for patients. It will ensure that follow-ups are done appropriately and in a timely manner, and actually opening up those lines of communications with GPs so that it's not just that one patient that we are affecting, but also it's having a general impact on the GP practice in terms of prescribing and deprescribing, etc., through shared learning.
It's really important for us to work closely with the GP to make sure those recommendations are followed through, but also to make sure then that the patients and the GP, everybody's happy with those outcomes, and the pharmacy are aware.
We're hoping to identify those patients when they're admitted to a nursing home and do a really good level 3 review with a pharmacist going into that nursing home, thinking about the sort of issues patients might have had with their medication in the past, hopefully liaising with relatives if needed to get a really good collateral history, and really working out how to optimise those medications for patients that are newly in a nursing home. But actually having the opportunity for a pharmacist to review patients in their home, looking at changes that have been made, and also in the context of their life and what they're wanting, their side effects, and how what their knowledge and understanding is of their own health and conditions, that's a really good opportunity to try to reduce medication-related harm. We feel as though doing that in a really patient-focused way will give extra benefits. So our pharmacists are going to have a particular approach, have training in shared decision-making and patient-focused medication reviews. And we feel that this will lead to hopefully particularly great benefits in helping patients understand their medication and making choices that are right for them.
We hope that through this project we will help improve the interface between community care and hospital care, so that when patients are discharged from hospital there'll be better communication flow from the hospital to the community with the help of the pharmacists and this project, and make that transition smoother for our patients.
We've already been doing some excellent work here which has had national attention and focus, and I feel by working with the AHSN, who are going to be supporting us with a bit of extra resource with a pharmacist and technician, we can further improve our project and also evaluate it more effectively, and hopefully get some recommendations about how we can improve it moving forward.
So we're going to take the learning from the Brighton and Hove project and then take that to 2 new CCG localities. And then also we'll be producing a toolkit so that once we've finished the pilots and the project, we'll be able to disseminate that learning across nationally, because we're obviously linked into the national AHSN network, and also locally within other areas within Kent, Surrey and Sussex.